Botox, best known for smoothing wrinkles, is being studied as a possible treatment for men with erectile dysfunction who haven't responded to pills or even penile injections. While it's not FDA approved and is still considered experimental, research over the past few years has shown promising results. The idea behind it is simple. Erections depend on relaxed, smooth muscle in the penis, so blood can flow in. The body's stress response system, called the sympathetic nervous system, can keep those muscles too tense, especially in men with conditions like high blood pressure, diabetes, or heart disease. Botox temporarily blocks this tension, letting the muscles relax and improving blood flow, much like how it relaxes facial muscles. Early studies, though small, were well designed and showed that men who had failed standard treatments often saw meaningful improvements after Botox injections. Some men who were close to needing penile implants became able to get firm erections again. Larger trials tested different doses and found that both worked, but higher doses lasted longer, usually about 6 to 9 months before another injection was needed. A strong study from 2020 showed that more than half of men receiving Botox were able to get erections firm enough for penetration compared to almost none in the placebo group. Another recent study found that Botox worked best when combined with Viagra rather than used alone. Real-world data is also encouraging. In one study of over 200 men, nearly half returned for repeat injections, suggesting they found it helpful. Response rates were highest in men with mild to moderate erectile dysfunction and lower in men with severe ED, though combining Botox with pills or penile injections improved success even in tougher cases. Men with nerve damage, such as after prostate cancer surgery or spinal cord injury, did not respond well because their issue wasn't related to blood flow. Safety so far looks good. The most common side effect is brief discomfort during the injection. A rare but serious risk is priapism, a prolonged, painful erection lasting more than 4 hours, which has been reported only once in these studies. No long-term or body-wide complications have been seen, although long-term research is still limited. Because Botox for ED is experimental, not covered by insurance, and not widely offered in the US, it's generally considered for men who have tried everything else and are thinking about surgery. If it works, it usually needs to be repeated every 6 to 9 months. Overall, the science makes sense. Early results are promising, and the treatment appears safe, but larger long-term studies are needed before it becomes a mainstream option.